welcome to the Art of Being Human. Now that we've discussed fentanyl, which we did on the last show, I'm going to go into the symptoms and withdrawal symptoms of the harder drugs, and by that I mean heroin, morphine, codeine, opium, and I'm also going to include Demerol, Percodan, and other kinds of drugs. And you know that the pain medications that you get, oxycodone, and medications like that are all kind of related to morphine, and so we have to include that in the hard drug category as well. You can get hooked on codeine, you can get hooked on hydrocodone and some of those medications that are used for pain control because they are harder drugs. Now, I'm not saying you shouldn't use them because if you have serious pain, it needs to be kept in control. Who wants to live their lives in serious, intractable pain? It's just an awful thing to go through. But you have to use medication carefully, especially if they are related to narcotics. And hydrocodone, these medications like that are related to morphine. So they basically are a kind of hard drug. So be very, very careful in terms of how you use them. In fact, I'll give you a personal experience. I had a lot of pain. This was years and years and years ago. And the doctor gave me something called Darvon Comp. And I used it for pain. And after I took my first pill, I felt so good. I was like in another world. I knew everything that was going on. I was fully in contact with reality. I was able to do everything I was going to do. But everything seemed wonderful. Everything was great. I was just so happy. And I thought, this can't be true. This isn't me. I mean, not that I'm an unhappy person. I tend to be a happy person. But this was an artificial elation that you wouldn't normally feel even when you're feeling good. It's like if you were to take a different level of degrees of being good, this was over the chart good. And everything was perfect and nothing was wrong. Nothing could be wrong. And I thought, this is really odd. Now, it lasted only for about 10 minutes. So I decided to try it again, just to see if that was some kind of an odd thing. So I waited for a while, and I wasn't taking anything more than what I was supposed to take. I kept it well within what I was scheduled to take. And I tried it again, and sure enough, the same thing happened. And I realized that this drug was affecting my mind and affecting how I would feel, and I would want to feel that good. There wasn't anything about that feeling that I would want to reject. It wasn't making me depressed, and I decided I can't take this anymore because it would be fairly easy to get hooked on this drug because I feel so good when I'm taking it. And a lot of people did feel that way, and a lot of people did get hooked on it, and a lot of people would actually go from door to door, ask people to use their bathrooms, knock on the door, say, gee, I have an emergency, can I use your bathroom? Now, normally you don't let a person in like that, but some people would, and they'd go through the medicine cabinets and steal all the Darvon, because they wanted that continual high. And it didn't last very long, so you had to keep taking the drug to get it. So that was my personal experience, and I did not take the drug any more than 2 or 3 times. I ended up by getting rid of it, because I wouldn't take the risk of getting hooked on something that made me feel that good. You don't know what's happening to your nervous system, and as I said before, when you take the drugs, it may be pleasurable to begin with, and you feel great, and you just can't envision anything bad happening to your brain and your spinal cord when you're taking those drugs. But then after a while, you get to have more and more of the drug to get the same effect. So a person will automatically do that. Well, I'll take a little more, so what? And then it takes more and more and more. And then by the time you realize you're in trouble, you're addicted, and you can't get off from it. You want to get off from it. It's hard to get off from it. And so you just keep going with the drug, and the drug becomes your master, and it demands that you take it because your brain physiology has changed, and the brain demands it, and you can't get off it by yourself due to the change of your brain physiology. Now, I know a lot of kids, a lot of people who will take drugs thinking I can stop at any time. If I can make the decision to get on it, all I have to do is say no and get off it. But by the time they get off from it or try to get off from it, they're so hooked they can't do it. They really can't do it due to the change in brain physiology. And I know it appears that I'm repeating myself, and I am, but I really need to make this clear. You take a drug sometimes out of curiosity. You want to know what it's like. And it makes you feel good, and then you lose the effect of the drug and you feel just like you did before. And because you feel just like you did before, you say, well, that's easy. I took it, nothing happened except I felt good, so therefore I can take it whenever I want to feel good. I'll just keep taking it, and then I'll go back to what I was before. But the thing is, you don't go back to what you were before after you've had a certain amount of the drug, because it changes the physiology and you can't get back. And that's the danger. To take a drug because you're curious, and kids do this all the time. Now you've got to remember that their brains are not really fully functional until they're 25 years old. So you have a teenager, a pre-teenager, and sometimes now even at the age of 6 they're experimenting with drugs. What is that doing to the structure of a developing brain? What happens to the developing brain that isn't fully grown anyway, can't make good decisions anyway simply because it's not mature enough to do so? That's just a matter of brain physiology. And then you're hammering it with a substance that's going to change it. Well, it's a very dangerous thing. And as you can see, we have a drug culture. Everybody's taking drugs. I had one of my students when I was teaching at a high school. She wasn't using, well, she was in a sense using drugs, but nothing that was illicit. She had aspirin with her all the time. And every time she felt nervous or she felt disoriented or something was wrong, she'd pop another aspirin pill. She was a nervous person, so she kept taking aspirin and aspirin in order to control her nerves. And that would be the wrong approach. The right approach would be, what are you afraid of and why are you afraid of it? Let's get down to the nitty-gritty and let's find out what's going on in your system that makes you feel that you have to have the aspirin. What's the nervousness like? There could be reasons, physical reasons for the nervousness. The hormones might not be in balance. There might be a problem with the thyroid gland not producing hormones correctly. And so there are lots of reasons why a person could be anxious. It doesn't necessarily have to be that something horrible is happening in their lives. It might be a case of physiology that can be corrected with real medication. So at any rate, getting off that and getting back to the use of these drugs, here are the symptoms of use. I'm going to give you a list. When you first start taking it, here are the symptoms of use. Euphoria, lethargy, you can be very, very uplifted but very tired at the same time. Somnolence, which means that you're sleeping. Apathy means you just don't care. Dysphoria, your emotions are out of balance. Bad judgment, the pupils constrict, they get smaller. You get drowsy, which is basically the same as lethargy, except I think lethargy is deeper, at a deeper level. And so it's like you're being drugged. It's not just that you're sleepy. Drowsiness is like you're sleepy. But when you get to lethargy, you feel like you're being drugged. Slurred speech, constipation, and they do advertise opioid medications will give constipation as a side effect. They do say that in the advertisement for the drugs, so that's not unusual. Nausea, decreased respiration, your breathing goes down. You don't breathe as deeply, you don't breathe as fast. That can be serious. And low blood pressure. And that can be serious too. Now, when you withdraw from these drugs, the withdrawal is going to start about 6 to 8 hours after the use of the drugs, and it's going to peak in 2 to 3 days. So if you are on a drug and you're feeling these as a side effect and you decide you've got to withdraw from the drugs, they're too dangerous, you don't want to take them, your withdrawal will start about 8 hours, 6 to 8 hours after you don't use them anymore. But you're going to have withdrawal symptoms that are going to peak in about 2 or 3 days. And by that time, you're practically tearing your hair out because withdrawal can be very, very, very serious. but they'll disappear. In about 7 to 10 days, the worst of the withdrawal symptoms are over. And so therefore, you don't have so much craving for it. But I think some people will tell you that their cravings for drugs never stop, and that's a problem. I know alcoholics that they will always crave it. Even though they've been away from alcohol for a long time, they will at some point always crave it. And all it takes is that one drink to make them hooked just as bad as they were before. You know, the thing with alcoholism, and I'm going to get into the alcoholism after I finish with this segment of drugs, but the thing with alcoholism is you can be an alcoholic, you can stop drinking, you may stop drinking for like 25 years, and then you take one drink, and your body deteriorates as if you had been drinking for those 20, 25 years that you had stopped. It's the body stops deteriorating when you stop the drinking. But then when you have that one drink and get back into it again, and all it takes is that one drink, your body will deteriorate so fast that it's as if you have been drinking all of those years when you were sober and weren't drinking. Nobody knows the reason for this. I've never read anything that would explain why the deterioration is so fast. But it is, and all it takes is that one drink. Now, after 7 to 10 days, you have the withdrawal symptoms are pretty much done. But here are the withdrawal symptoms. I haven't told you what they are yet. Intense craving, nausea, vomiting, muscle aches, the pupils will dilate, there'll be a lot of sweating, diarrhea, and insomnia. You know, it's easy enough to list off a bunch of symptoms. Oh, nauseated, dizzy, you know, diarrhea. Okay, these are the symptoms, and you list them off. And okay, I'm reading them from a piece of paper. But if you're experiencing them, and you have all of those things at the same time, that's terrible. Your suffering is going to be terrible. Those are the withdrawal symptoms. So at this point, you really need to have some professional help, people who can help you through that. Some people are able to do it alone. I've known of that happening. I've known people in which that's happened and they just have stopped cold turkey. But it can be dangerous and you need medical supervision because your body is reacting violently to the fact that it's not getting what it craves. And by this time you're so hooked, your body is totally convinced that it needs it. It's not the case anymore that you want it. It's a case that you need it. And when you try to stop, your brain is not going to let you do that. So if you force it, you go through the horrible withdrawal. So a lot of people continue on drugs simply because they have to stop the withdrawal symptoms because they can't tolerate the withdrawal symptoms. So if you need help, you must get help, and there's help available for you. Now, for sedatives, you know, a lot of people get hooked on sedatives, and here's the symptoms of the sedative use. Mood lability. Now, lability means you're all over the place. If you're a labile person, you're up, you're down. You know, it's not like you're steady. You're not steady. Oh, I feel this way, and I feel this way all day, or I feel this way for 2 or 3 hours. Excuse me, and then after that, I'm back to normal again. Your mood changes all the time. Poor judgment, slurred speech, incoordination. You don't have good coordination. You're falling. You know, people who are drunk, you see them walking on the street and they're staggering. Unsteady gait. Attention is impaired. You can't pay attention to anything. Your memory is confused. You have total confusion. And so you can't really function as a normal person. If you've ever taken a sedative and you've reacted badly to it, you probably have some of these symptoms. When you have some of these symptoms, you can't concentrate, you can't figure out what's going on, you don't feel good, you feel drugged, there's no attention span, and you just don't feel like yourself at all. And this is what you get if you use too much sedatives, or if you're having a bad reaction and you have a pill that's been prescribed for you, but for some reason your body doesn't want it, you become allergic to it, or you can't tolerate it. There's some people have medications they can't tolerate. It's not a true allergy. They're not going to go into anaphylactic shock, but they just can't tolerate what it does to them because it causes them not to be able to function normally. But these will be the withdrawal symptoms of sedatives: nausea, vomiting, malaise. Malaise is when you just don't feel good. You know, you're not up, you're not completely down, you just don't feel good. Nothing seems right, and you're not very happy. And it's not like a depressed, but it's not a high either. It's just kind of, I wished I wasn't doing this. I wished I didn't have to work. I wished I didn't have to do anything that I didn't want to do. I don't feel right. That kind of thing. It's hard to describe it. Weakness, tachycardia. Tachycardia is when your heartbeat is not normal, and it's usually fast. You can have abnormally fast beats in your heart, or you can have abnormally slow beats in your heart. Both are bad, but tachycardia, you're beating, but you're not beating steady. Some people have that problem, however, without using drugs. It's just innate in their systems, or they have heart trouble, and that happens to them as well. Sweating, anxiety, irritability, tremor. That tremor is just that shaking, insomnia, seizures, all of those. I'll read this again: nausea, vomiting, malaise, weakness, tachycardia, sweating, anxiety, irritability, tremor, insomnia, and seizures. They're very bad just from the symptoms of using sedatives. You have to be careful of sedatives. You can get way too much. Now, the withdrawal is going to progress. If it gets worse than this, it can progress to being delirious in about 1 week after the use of the sedative. So if it continues, you can become delirious. Now, delirious means this, that you're not right. You can't speak right. Everything you say is kind of like gobbledygook. It doesn't make any sense. You're not making any sense when you talk. You don't know what you're talking about. Everything is just all mixed up. You would expect to see that in some kind of mental illnesses where people are, it's called confabulating. They're talking, but it doesn't make any sense of what they're saying at all. So the withdrawal is tough. And when we talk about the opioids, when we talk about the hard drugs, this is what the withdrawal is going to be like with hard drugs. Hyperactivity, a person is too alert, that is, they're hypervigilant, you know. They watch everything, they see everything. It's almost like they have spy eyes or something, but they're too alert. They have rapid breathing, very fast breathing, agitation. They constantly have to be moving. They constantly have to be doing something. They can't settle down. And if they're agitated, they're usually temporary, which means they're going to be argumentative. They're going to be hard to handle. They have fast heart rates, fever, crying, perspiration, a runny nose, tremors, which is the shaking, muscle twitching. It's not shaking, but every so often you kind of jerk or something like that. You can have hot and cold flashes where you feel very, very hot, like a hot flash that a woman might get in menopause, and she feels like she's just burning up. But you can have cold, chills as well. And I don't know which is worse, but you can have both of them. I've known people to have both at the same time. I don't know how the body does that, but it does. Aching muscles, cramps, diarrhea. Now, this is going to start about 4 to 6 hours after the drug use has stopped. So 4 to 6 hours after you've had your last dose of drugs, the withdrawal will start. Is it any wonder that people are constantly on the lookout to get their next hit, to get enough money to buy more drugs, because they know when they're high, it's only going to be 4 hours, and they're going to start having all of these horrible symptoms. It peaks in about 36 to 72 hours, 36 to 72 hours. And then after that, it starts to to dissipate. But you can get a lot of complications from drug use. And I want to list some of these complications from the use of hard drugs. You can get hepatitis, you can get bone infections, skin sores, lung problems, pneumonia, pulmonary emboli, in which your breathing is really in danger, immune system problems, neurologic problems in which you can't move. Your nerves just are not working right, and so therefore your movement, everything is all not working right. You can go into coma, you can have paralysis, double vision, Guillain-Barré. Guillain-Barré is a few years ago was talked about a lot. It's like an infection in your nervous system where your nervous system can shut down and you have paralysis. And usually say if you're getting a virus or something, a Guillain-Barré can be a virus or a bacterial infection, and it stops your body from functioning. Sometimes it can stop you from breathing. It stops movement. You can't move your body right. You become somewhat paralyzed. A lot of people do recover from it. A lot of cruise ships, in one segment of society a few years ago, cruise ships, people were breaking down with Guillain-Barré, and they hadn't done anything to have it. They hadn't used drugs, but somehow they were getting the infection aboard the ships. And then as a result of that, some of them had partial paralysis. You can have skin abscesses, and if you have an overdose, you can die from it. Those are the complications of drug use. Now, babies can be born being drug addicted. If the mother is using drugs, the drugs get into the baby through the placenta. There's no barrier that holds them back, so you have a baby that is addicted to drugs when it's born. So as soon as it's born and it's separated from the umbilical cord of the mother, it starts its withdrawal because it is now separated from the drugs it has been getting from the umbilical cord. And that's a very, very sad thing to see. They shake, they cry, they scream, they're in pain, and their little bodies are just shaking like this. Their little legs are moving. It's just a very, very pitiful thing. They have tremors, high-pitched crying, jitters, seizures, rapid breathing. What a horrible thing for a newborn baby to experience. They can't help themselves at any rate, and so it takes time. They have to go through withdrawal, and I don't know what that will affect their personalities, but I can imagine it does. Now, we don't have any time left. I'm going to start marijuana next time, and we'll go into that. So we'll stop here, and we'll do that next time. Please join me then.